for the approach and general principle. First, overview of pelvic ring injury. We can make a diagnosis and classification of pelvic ring injuries because pelvic ring is made of some ring structure that is different from bone bone fracture. So it has an anterior compartment and posterior compartment. And Young-Boger's classification made its classification according to the outer force applied to the pelvis. It can as a anterior to posterior direction and lateral compression direction and vertical shear. That is from fall down from height that injury can be occurred. And next, tile and AO classification is divided according to the severity. So you can divide into intact posterior arch and incomplete posterior arch and complete posterior injury. And next, to make a diagnosis, we have to see look X-rays. First, in left view is the X-rays go to perpendicular to the pelvic ring, and it can detect the anterior posterior displacement and rotational displacement. And next, outlet view can be used. It can be detect cephalic and caudal translation and suspected fracture of lateral pubic ramus fracture. And CT scan can usually perform nowadays because pelvis ring structure we have to see more specifically. So CT scan provide necessary anatomical detail, but we have to. You can overlook the symphysis diastasis when we use the CT scan because when people in the CT scan, the pelvis can in circumferential structure, so it can be like when people in the CT scan, the injury is high, but when we use the simple X-ray, it can be detected. So we should be aware of beware of CT scan. And next is urogenital injury and abdominal injury and developing like that accompanying injuries we should aware. Next is approaches and principle for pelvic injuries. First, as I said, pelvis is divided into posterior structure and anterior structure. So when there was anterior ring injuries, there can several anterior exposure, fundesterior exposure, and stopper approaches that is associated acetabular injury and high range fracture. You can use stopper approach and total surgery. And next, we can approach to the posterior structure of pelvis and using the anterior approach or posterior structure through the lateral window of iliolumbar approach. And next, when we approach the posterior part of posterior pelvis, we can use front. We can perform when the patient is a prone position and sacroiliac joint and sacrum is approached using the posterior exposure. And there was a percutaneous method for like this screw insertion. And next, it is a general principle for pelvic fracture surgery. And compared to anterior structure, posterior injury is more critical one. So posterior injury require acute reduction and stable fixation. And complete posterior instability, when there was a complete posterior instability, only anterior fixation cannot maintain that stability. So posterior fixation should be accompanied. And when there was a vertical instability, posterior fixation should be done. So the summary is when we treat pelvic ring injury, we have to diagnose it well through the considering outer force and make a choice of good approaches according to general principle. Thank you.
Okay. Feedback.
Thank you, Karim. Yeah. The first thing is I want to ask, in your lecture, what did you go where?
First, I make a end up before 5 minutes, so I make a time limit. And the next thing is, and I think I'm not sure it's a good one or bad one, but I explain necessary part of the classification and approaches, but I think it also too much for 5 minute lecture. That's it.
I'm gonna ask about that. So I think that the good thing in your lecture, I think that your tone and your speech speed, I think is very good. And I think you talk about the classifications, actually the planning procedure and approach, right? Yeah. I think you are very well prepared about that one, and your message is very clear. But then, what is in the next time? What are you going to do differently in your lecture?
First, because of some language-wise problem, I have some bumming of the speaking, and I think there was a lack of practical some presentation or prepare rehearsal, I think, and too much text on the X-ray and presentation maybe, and this learning objective and summary is missing.
And in the viewpoint of audience, what's your main message in your presentation? What they can get?
So I think it was too much take-home message, so classification and X-rays approaches. So the main point is for the planning of the pelvis fracture. That point is important, but the specific point is too much, so I cannot say one thing.
How about the focus on the classification, or how about the focus on the approach? In 5 minutes.
I think so.
Yeah. And personally, I think that in my question is, what's the difference between the two types of classification system? What is the good point, or what is the bad point for this classification system? I wonder. I want to know that one. In the next time, what about to talk about that one?
So per your recommendation, I think I will have a more time distribution for explanation about classification more specifically. So I just reading about the classification, but next time I will more in, for example, clinical situation for accident or reduction force according to the classification type. I will present that.
And that in the viewpoint approach, what are you going to do differently in the next presentation?
So it also has very short time this time, and I just speaking name of approach and where to see through the approach. But if I present next time, and I actually the 5 minute only approach can I have to explain about approach in 5 minutes. So if I perform this next time in one approach for the medical photo of this approach and some indications and specific some structural force should avoid during approach like I was speaking about.
I think in the critical setting, when the surgeon do something for the pelvis fracture, they have to choose approach, right? According to some kind of indication. So what about to talk about that? we have to allow the approach, but they have own big point, they have some advantage. So what about the principle about that?
I think if I perform next time, I will present some one or two major approach through the real case. That will be more effective than this time.
Thank you. Thank you for it.
Okay, thank you very much. Okay, feedback
For
from the
feedback.
audience? Feedback on the feedback?
Thank you for your lecture, and it went well, and I could understand your lecture. And at first, you clarified that the presentation was for education, but personally, I thought that I did not, because I did not know much about agriculture. From the beginning, I did not know what was the most important issue in the classifying agriculture, and then what will happen if it is classified wrong. So from the beginning, if you put the slide which draw the attention of the audience, it will have a more educated. The listener can focus on that issue and can follow the lecture in the perspective.
Okay, so I think that's on the content, you know? Yeah, I understand that also. So I think content management, what is you're gonna say in 5 minutes is important. It usually, I do a lot of public practice too, I started practice, and you usually build up on something, right? So the presumption is, when we're talking about planning for any spine or anything, joints, you already have the diagnosis, you already have a classification, etc., etc. So, right? So my presumption there is, because you have very limited time, you also want to manage what it is you're gonna say. The audience is supposed to already know that. You can give a very short overview, maybe, but remember you have very limited time. So content management, I think, is important. Okay, any comments on anything else? Anything else?
I think it's
Yeah.
like maybe language problem. You read from the slide too much.
You what?
He read the slides.
Ah,
text,
okay.
he read the text from the slides.
Okay.
Yes.
Comments on the feedback?
Feedback.
Yeah. Feedback on the feedback. Yeah. So anything you'd like to comment about, or what do you think went well and what we should do differently on the feedback?
I think today's topic, today's goal is focused on the presentation skill, but you feedback about the
Content.
pelvic fracture. So
Yeah. Content.
I would like to improve our presentation skill. So I get a lot from your feedback.
Yeah.
So what are the presenter like?
Well, yeah, good point, no? But when you give feedback, you give a feedback on all, okay? Content, manner of presentation, etc., etc. Even the way he dresses, sometimes, no? Although AO courses are just relaxed, no? But that's overall, you look at everything. No? I think what went well in the giving of feedback is you're asking specific questions. No? You keep on asking questions on per topic, you know, which I think is pretty good, you know? And you have to have a good knowledge as well on the topic to be able to do that. Okay, anything else? One more, I think we have 1 minute left, already expired. Time's out. Okay,
Just a comment.
but I hope we pick up some